Hey Swede Nation, it's Dr. Rhodes, Superintendent of Schools. When we opened our doors to start the 2021 school year back in August, we didn't know what to expect. There were all kinds of challenges related to the coronavirus, but you have helped us overcome those challenges. You've masked up, you've maintained social distance when possible, and you've practiced good hand washing hygiene. Because you've practiced those safety protocols, we've been able to keep our doors open. Now we have a new challenge. We have families, neighbors, and community members who are being negatively impacted by the virus. What can you do as students? You continue to mask up inside and outside of the school. Avoid large gatherings. Avoid close contact outside of school. Keep your social distance and continue to practice good hand washing hygiene in and outside of the doors of this school. We can overcome this together. Lastly, you can help educate your family and loved ones on how important these safety protocols are to slow the spread of the virus and keep our doors open. Together we can make it through this, and we will make it through this. And now here's an important message from our friends at Gothenburg Health.
Please listen to the healthcare experts, get good factual information. I do not think that social media always has the best information, so fact check and know where your information is coming from. And if you're doing that, then you're hearing what we're telling you, which is please wear a mask and work on socially distancing.
This is very real. I know we're all tired, and I know it's easy if this doesn't affect you personally. Or you haven't had a family member affected by it, it's easy to think like maybe this is overblown or maybe this is just something that's been a little bit fabricated by the media, but it is very real and we're just really tired. And the thought of looking into a couple more months of this, it's really daunting and it's really hard emotionally to wake up every day and continue doing it. So please wear a mask, please try to social distance, and just try to be smart when you're getting together with people of ways to limit the risk that you're putting in both you and your family.
You know, this may not affect you, but it affects others. It affects the elderly, it affects people with other significant healthcare problems. It is very difficult right now because we have such a high hospitalization rate. I mean, ICUs are full, beds are full. It is very frustrating when you have people that are coming in and are ill and need to be transferred, and we have no place to transfer them. And so my plea would be, even though you yourself feel good and you have COVID or you have symptoms, be considerate of others and try to limit spreading things as much as possible.
This affects all of us. And I don't know many people in town that probably haven't met or know somebody who's lost a loved one or a relative. And unfortunately, I think this is far from over. I don't think we're getting herd immunity, we're getting herd thinning. And the studies would show that the long-term antibodies from France and from Spain lasted about 2 to 4 months. So we need to figure out how to live in a world with COVID, respect it, don't fear it. I tell my patients it's just like a rattlesnake. I don't expect you to run away and scream, but I expect you to use good judgment and manage the situation, because this is a problem that none of us have ever seen before. And until we have full herd immunity with immunizations and practice good social distancing, I think this is going to continue to be a problem. And the sooner we can get to doing these things, the sooner we can get back to our normal ways of lives.
Well, the trajectory we're on right now is saturating our ability to care for patients. We may actually have patients overflowing into the hallway, and it's a pretty serious situation. You know, it also is a situation where we don't have enough nurses or staff available to care for all those patients. So everyone needs to wear their mask and do their part to try to tamp this down as best we can.
Final plea is to the community of Gothenburg and also the surrounding communities. We all have been affected by this. I think as healthcare providers, we have all lost patients by this, and it was one of the toughest things I've had to experience. I just plead that you guys will do what's right for yourself, for the community and others. This is about respect. This is about hope. Our nurses are tired. Us providers are getting tired. It's time for the community to step up and do what they need to do.